Hey guys, I'm Nicole, and today I'm going to be talking about an upper GI series and a barium swallow. So first and foremost, you might be wondering, what is this? So it is an X-ray, which is done under fluoroscopy of the upper GI tract, which consists of the stomach, the esophagus, and the duodenum. So barium is a chalky liquid that your patient is going to drink, and it's going to illuminate the organs in the tract, and it allows it to be more visible under the x-ray screen. So for this procedure, a couple things to know. There are two different types. So the first one is going to be in which your patient just drinks the barium beverage, and we wait for it to travel through the GI tract for it to be more visible, to light up those organs. And then there is a second one too that allows for a clearer look at the stomach lining, in which your patient is going to either drink a carbonated beverage, or they might consume a powder or a tablet that's going to produce gas in order to instill air into the GI tract for everything to be more visible. So why is this patient being ordered an upper GI series? Could be a couple of different reasons. They may have persistent nausea and vomiting, unexplained abdominal pain, any kind of difficulty swallowing, or any kind of unexplained weight loss. So these procedures can show esophageal varices, any kind of gastroesophageal reflux, or even if your patient's just having that unexplained weight loss, they haven't been dieting, anything like that. So when we're preparing our patient, we want to let them know that for 8 hours before the procedure, they're going to remain NPO. So this also pertains to water consumption, as well as smoking and gum chewing. We want to let them know they will not be put under anesthesia, but it could take a little while, somewhere between 2 to 5 hours, depending on how long it takes for the barium to travel through the gastrointestinal system. They might be standing, they may be laying flat, as you see in this picture here. It all really depends on the x-ray tech who's performing the procedure. And they may have to change positions in order for them to get different views, or for the barium to be evenly distributed throughout the intestines. So after your patient has this procedure done, some quick simple things. It is just an x-ray, so nothing crazy. We're going to want to monitor them for cramping and bloating, as those are the most common signs and symptoms for after your patient has this procedure. We're going to want to assess their bowel movements. So because of the barium working its way through the intestinal system, they may have some white or light colored bowel movements. We want to make sure that we inform them of that so they're not alarmed. And then we're going to also want to make sure that we're assessing for any kind of fever or inability to flatulate. And make sure that they're not going greater than 2 days without a bowel movement, because that could be a sign of a complication from the procedure, which is rare but can happen. So again, this procedure can show a lot of different things, as you can see in these images. By doing the barium swallow, the patient has organs that are illuminated. If there was any kind of obstruction, anything like that, it would be shown as well. And that's it.